Hi, class. We are going to be talking about the kidney, and let's look at some of the other anatomy of the kidney. Um, get an idea as to what this term retroperitoneal means. We remember the peritoneal cavity, right? The peritoneum. We learned this in A&P 1 when we talked about the heart, and then we talked about the lungs. And then we talked about the digestive organs and the reproductive organs, right? So we had the pleura here, and we had the cardia here, right? Like pericardium, epicardium, or visceral parietal pleura. Here we have the peritoneum, peritoneum. So we have the visceral and parietal peritoneum. There's a visceral and parietal pleura. There's a visceral and parietal pericardium. All right. So peritoneum and retro, now this means we are behind the peritoneum. So right here, you could see the peritoneum. This is anterior. Back here is posterior. This is posterior. So we can see that the kidneys, which are here, you can see it here, the left kidney, and here's the right kidney. So the kidneys are behind or retroperitoneum. We can also see that we have one, two, three other layers that protect the kidney. We have fascia, we have fat, and we have the renal capsule, all responsible for insulating and protecting the kidneys. We have these different layers, again, retroperitoneum. So the renal fascia anchors to other structures. The adipose is responsible for protecting and anchoring the kidneys. And the renal capsule is continuous with the ureter. Okay, and these are the layers from superficial to deep. The fascia is most superficial, and the renal capsule is closest to the actual kidneys. Now we're looking at it from posterior, so we can see the right kidney is lower than the left. We could see why people would experience lower back pain, especially if someone's drinking maybe not enough water or too much coffee, and they're putting strain on the kidneys. They can experience lots of lower back pain if they're passing a stone, a kidney stone that gets lodged here in the ureters. Kidney stones are like passing sharp glass. And if you have sharp glass moving through these junctions, it could be very, very, very painful. Okay. Again, you could see the abdominal aorta. We could see the renal artery branching into the kidneys. You could see both ureters. We could see the urinary bladder and the urethra. Now let's take a look at this. This is just a dissection. And again, you can see we have the choices here, and we could just drag and drop. So this structure right there, that's the abdominal aorta. And the one adjacent to it, that's the inferior vena cava. Off the abdominal aorta, way up high, that first blood vessel that come off, it's always that celiac artery or the celiac trunk. Then just inferior to that is the superior mesenteric artery. And then way down on the bottom, that's the inferior mesenteric artery. Remember, the superior mesenterics and inferior mesenterics, that's going to feed the intestines. Coming off the abdominal aorta, going into both kidneys, we can see the renal arteries. And then we could see a section of the renal vein. Okay. And we could see the left renal artery as well, coming off the abdominal aorta. Okay, here is that's the spleen right there. Here's the abdominal aorta right here. That is the celiac trunk. That's the superior mesenteric. That's the renal artery. That's the kidney. That most closest part that's lining the kidney, that's going to be the renal capsule. But this entire structure, pretty basic forward answer, that's going to be the left kidney. There's this indented area right here, which is where the entrance for the renal artery, the renal vein, the ureters, the nerves, and lymphatics, how they enter into the kidney, and that's called the hilum or the renal hilum. That is the entrance for all the vessels into the kidney. So here's the kidney. You can see this looks like the ureter. This looks like the renal artery. And this indented concave area is referred to as the renal hilum. Okay, can't be the renal artery. The renal cortex, well, you have to have a cross section to see the renal cortex, and we need a cross section for the renal medulla. We know it's not the ureter because that's the ureter. This is the fibrous capsule. Let's review the renal cortex, the renal medulla, the renal pyramids, the renal columns. Let's take a look at it in a larger picture. So now, going here, we can see the renal cortex. We'll call that number 1 right here. That's the outer part. Here's the renal capsule. It's a fibrous capsule. Well, the cortex is outside. The renal medulla is inside. That's this region. When we give this the pyramidal shape, like a triangle or a pyramid, then we call it the renal pyramid. Between each pyramid, that's where we have, let's call this number 4, the renal columns. The renal columns are in between each pyramid. Okay, so let's take a look at what happens at the apex of the pyramid. So here's the base, right here is the apex. Now let's call this A, A, A. All of these we'll call A. All of the A's are the minor calyx. We'll call this B, B, B. All the B's are major calyx. The renal pelvis we'll call C. And then the ureter we will call D. So that's kind of the flow. A, B, C, D. Minor calyx, major calyx, renal pelvis, ureter. Minor calyx, major calyx, renal pelvis, ureter. Minor calyx, major calyx, renal pelvis, ureter. Okay. You can see these little cavities right here. These are called the renal sinus right here. That's a renal sinus. This is a renal sinus. All these little cavities here are renal sinuses. At the apex, one other landmark I want to point out here, because we're going to hear it in a second, right at the tip of the pyramids is a region called the papilla, renal papilla. That is the renal papilla. Okay, keep that in mind. So when we look here, again, let's look at the path of urinary drainage. So this yellow structure, which I've only mentioned by name briefly, the nephron, it's this tubular structure. We see that some of it is in the renal cortex, and we see some of it is in the renal medulla. Okay. And within this tubular structure called the nephron, this nephron is responsible for filtration. Like it's a filter, it's going to filter. It can reabsorb, it can secrete, and it can excrete. And I'll go over in more detail what this looks like. But it's basically saying as blood comes into the kidney, this nephron is going to say, hey, we got some good stuff, and the good stuff we're going to keep. We want to reabsorb it. The bad stuff we're going to secrete, we're going to put it in this tubular system so that eventually we can excrete it outside the body. And it's going to filter because it's going to say, hey, let's clean this up a little bit. Okay. So when it decides that, hey, we're going to excrete and push this outside of the body, it's going to go through this nephron, through this collecting duct right here. The collecting duct goes into a papillary duct. And this papillary duct, the reason why I bring this up, because remember I said renal papilla right here at the apex of each pyramid. So now we have a papillary duct. So this is an opening. And where does that papillary duct lead into? Oh, A, B, C, D. A, B, C, D. The minor calyx to the major calyx to the renal pelvis to the ureter. And eventually the ureter leads into the urinary bladder. Okay, when we look at same stuff, now we're just looking at a dissected kidney. Again, it's like a drag and drop. So we know the outer part is called the renal cortex. The inner part, which is where we have the medulla, right? When it's this way, that region is the medulla. But now this right here, that is a pyramid. That is a pyramid. That's the renal pyramid. In between each pyramid, we have renal columns, and then those little cavities are called renal sinuses. Right? So now here, this region is the cortex. These right here are, it's in the medullary region, but notice they're not going to give you those two choices. So although it is in the medullary region, they're giving you the shape of the pyramids. So that's the renal pyramid. In between each pyramid, we have the renal columns. Here is the pyramid at the very tip. That's the renal papilla. After the renal papilla, here's our minor calyx, right? That's what we called A. Then the major calyx was B. The renal pelvis was C. And the ureter was D. Those are the letters that I used in that previous slide if you want to go back and review it. So urine is kind of coming this way through the renal papilla into the minor calyx, major calyx, renal pelvis, ureter, and eventually into the urinary bladder. So that was the pyramid, that was the papilla, and the urine ends up in the very first part called the minor calyx. Minor, 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 then it leads to a major, major. The majors then lead into the renal pelvis, which is here. and then eventually into the ureter here. The cavities are the renal sinuses. Okay, let's see if we can make this out a little bit. You could zoom in if you need to. So minor calyx would be right at the apex of the pyramid, so that's minor calyx. As we move down, there's the major calyx. As we move down to the next segment, that's the renal pelvis. And as we move further down, there's the ureter. This is a renal pyramid, just one of them. The cavities, that's the renal sinus. And then what surrounds the kidneys is all this fat or adipose. The ureters lead into the urinary bladder. Okay, it takes a little practice. Takes a little practice to get these down. Okay, take a break. When we come back, we're going to get into the blood supply.